Good evening everyone, and welcome to the live question and answer session with the Ministers on our hospital project. We're absolutely delighted to have you joining us at home this evening. We're thrilled to have a live studio audience who are here ready with their questions, and I'm going to introduce you to the Ministers very shortly. My name's Jennifer Carnegie and it's my real pleasure to be hosting you this evening. The Our Hospital Review has provided advice to the States Assembly about whether any changes should be made to deliver a more affordable and appropriate offering to the Overdale proposals that were agreed by the States Assembly previously. This review has been part of the Chief Minister's 100-day plan. It started on the 1st of September and it completed on the 1st of November. 60 key stakeholders were involved, along with some visits to Northern Ireland to check out various healthcare facilities. The review found the current plan no longer achievable, with almost 805 million funding approved by the States last Assembly not going to be enough. They think the costs of that with the current economic climate will be up to almost 20% more, with up to 115 billion costing 15 million extra. The review suggests that we replace with a phased development across multiple sites, of which the existing hospital, Overdale and Kensington Place will be one. Just before I introduce you to the panel, I'd like to remind you about using Slido. We've had a fantastic selection of questions already this evening. Please do feel free to send some more. Go to slido.com and the code that you need is OH Review, Our Hospital Review. Put that in, you'll be able to see the questions. If you like a particular question, you can click the thumbs up next to it, and that improves the popularity. The more thumbs that a question gets, the higher it goes to the top of the list, and we'll be taking the questions the most popular first. We will be interspersing that with some questions from the audience as well, so we're looking forward to it. So without any further ado, let's hear from the people that you're really here to hear from. I'd like to introduce you to the Chief Minister, Deputy Christina Moore, who commissioned the report. Christina, I think you'd like to say a few words to begin with.
Good evening, Jennifer, and good evening to everybody who's joining us here in the studio and everybody who's joining us online too. It's really great to see you all here, and also thank you for your interest, because this is a really important topic. Affordability isn't an exciting term, is it? But when we as elected politicians have to spend your money, public money, then it's absolutely critical that we take the right choice and we find an affordable solution. Now, we found that the solution that was agreed by the previous Assembly is simply not affordable, and particularly not so in this current economic climate. So what we've done is do what we said we would do during the elections, and you kindly chose us to be your politicians and to take decisions on your behalf in the Assembly. So we've conducted a rapid review, and that has offered us a clear vision forward, a way to deliver a new health facility for the island, and one that is pragmatic, one that's resilient, and also one that's affordable. So thank you very much for taking an interest. Really, it's very important that we're here just to answer your questions, and we will continue to do so throughout this process.
Thank you, Chief Minister. I'd also like to introduce you to the rest of the panel. We have the Minister for Treasury and Resources, Deputy Ian Gorst, who I think its focus is ensuring that we find a model that represents value for money and doesn't burden society with debt going into the future. Welcome, Deputy Gorst.
Thank you.
We've also got on my right-hand side here, we've got the Minister for Infrastructure, Deputy Tom Binney. Tom led the review as part of the Chief Minister's 100-day actions alongside an independent expert called Alan Moore. We'll hear more about that later, I'm sure. And last but most certainly not least, we'd like to welcome the Minister for Health and Social Services, Deputy Karen Wilson. Karen's focus is ensuring that we engage with the healthcare workers across the island and that the new facility is offering the best that it can. Thank you very much. So to get the ball rolling, I'm going to ask each of the panel members an introductory question, and then we're going to come to your questions. Chief Minister, given the number of years that we've been debating the new hospital, and the fact that Jersey people, by and large, just want the government to get on with it, what has driven the need for a review of a legitimate decision that was made in the States Assembly under the previous administration?
Well, thank you for the question. It's an interesting one, and I absolutely ask the same question myself. But having followed, I think, all of the iterations of the hospital project over the past 10 years, I'm very familiar with the many decisions that have been taken. During the last 4 years of government, I became quite well known as a scrutineer, and I watched the decision making and became increasingly frustrated by it. But our scrutiny process was, of course, an independent and objective process, found that the outline business case that was put forward for the last project was neither the size and scale of it had not been properly justified, and equally there were some elements of the Treasury Green Book process that hadn't been properly followed, and the position where we got to with the last Assembly and the financial agreement that they came to is just not deliverable now. The project is already way in excess of that figure of 804 million that the previous Assembly agreed. And so I think very strongly that we need a pragmatic way forward. But having gone through those 10 years of decision making, there are plenty of options on the table, and we have plenty of information available to us with which to make the right decision.
Thank you very much. I see members of the audience sharpening their pencils to come back on some of those points, which we'll address later, I'm sure. Deputy Gorst, having previously supported the Overdale site, what are your reasons for supporting what some describe as a fairly superficial and hasty review?
Well, I think Tom can explain why it's not a superficial and hasty review. I don't believe it is at all if you actually look at it. It became apparent to me in the run-up to the election, because of what was already happening in the global economic situation, that the hospital as previously envisaged, for all sorts of reasons, was no longer deliverable within the decisions that the states had approved. Now, we can look back and say, had that process moved quicker, it might have been deliverable at a lesser cost. But as you've gone through the process, as the Chief Minister's just explained, it was apparent, because of rising interest rates, and that's risen even more since back at the election, you couldn't deliver what was proposed and what had planning permission within the budget that was approved by the states. It's going to cost, and now the review tells us it's going to cost over 100 million more, 115, 150 million more. That's moving all the time because of the increasing inflation rates. It also became apparent that you couldn't fund it in the way that the states had previously thought, because you've got inflation happening, you've got interest rates happening, and therefore the most sensible thing to do for any incoming government, whatever their previous position was to do this quick review to be able to have this conversation, because we are all committed to moving forward.
OK, we'll come back to some of those points as well later, I'm sure. Thank you very much. Deputy Binney, was the previous plan rejected from the outset, or was this a genuine review of all the options?
Absolutely, it was a genuine review. That sort of question assumes that I came to this job with a predetermined idea of what I wanted. And if I could go back to square one, what we're looking at now might not be what I'd opt for. I came to this with an objective mind, and the decisions that we've taken are based on the facts and the new financial situation that we find ourselves confronted with.
Yes, sir.
So completely objective as far as I'm concerned.
OK, thank you. Deputy Wilson, the previous plan put great store by clinical advice that the best solution for healthcare in the island would be on a single site. How much does splitting the hospital across multiple sites undermine clinical provision?
Well, I think the most important thing to remember is that whatever discussions have gone on around clinical appropriateness, there is always the needs of addressing patients. And I think when we've looked at the review in terms of affordability, it's our job now to actually make sure that patients have got the services that they rightly deserve. And the important thing going forward is to work with clinicians and patients as well to make sure that what we provide going forward is fit for purpose and actually delivers the right solution for our healthcare system.
Thank you. OK, now we've got everybody warmed up. I think we're ready to go. We're going to come to the audience and our viewers at home through Slido. Please, slido.com, OH Review is the tag. Continue to ask your questions. We're going to try and handle them as much as possible in 3 blocks. Review and finances first thing, then looking at is it the right thing for Jersey, and then healthcare. But you know, if there's questions that cut across that, that's okay. So I would like to go to the audience first of all. Is there anybody particularly? I'd like you to put your hand up, please, if you want to ask a question. Deputy Farnham.
Thank you. And thank you, Chief Minister and Ministers, for inviting us here this evening and for allowing me to be here. I promise to be on my best behaviour. So I'm sure we all want the same thing. We all have different ideas of how we might get there, but I'm sure all of us want to produce the right hospital for Jersey at the right price, in the right place, and importantly that provides us with the right clinical care for our patients. So my question is to the ministers, how can you reconcile the decision to abandon the Overdale site, a single site solution, against the clear and unequivocal advice from the clinicians, the doctors, the nurses and the healthcare staff who say that a single site solution will deliver much better clinical patient outcomes? And secondly, the assertion that the scheme is unaffordable, I think, needs to be challenged, and I'm looking forward to doing that at the appropriate time in the States Assembly. But given that the scheme you've proposed is going to operate over a number of different sites, take almost twice as long to complete, and is therefore likely to, or possibly likely to cost more money and take twice as long, how can you reconcile that against the health requirement? Are we indeed putting money in front of people's lives and health? Thank you.
Okay, thank you. I think if I can direct the healthcare part of that question.
Yes, thank you. And thank you for the question. I think the views on how we provide healthcare across the island vary hugely. And I think the value of involving clinicians in that decision making will continue going forward. We're not going to be discounting the work that's already been done. That's been very valuable in informing, but the conditions under which we're going to be providing services going forward have changed. And we have to be adaptable, and we have to recognise that affordability in healthcare is a real issue. And in order to actually get the best outcomes for patients, we've got to start to think about how we can revisit some of those decisions and some of those commitments that we made previously to actually fit in with the current circumstances in which we operate and we find ourselves at this moment in time. And I want to give my commitment to clinicians and to patients to say, however we move forward, particularly around the outcome that the review has indicated that we should, is that we should start to build on the work that is already done to make sure that we've got safe, effective services, to make sure that we've got clinical engagement and we've got patient engagement, and we end up with the services that are actually going to deliver really good outcomes for people.
So you say that the situation has changed for people and everybody is well aware of what's going on globally in terms of the economy and cost of living crisis. Has it changed that much for people in Jersey to justify changing everything that was decided not that long ago?
Well, I think the conditions, Jennifer, are really stark, and I think the Treasury Minister has outlined the financial position. And my answer to that would be yes, they have dramatically, you know, and I think Tom would probably want to come in because in terms of materials,
I'd be very keen to come in because as I recall, what the promise on the Our Hospital project was that we were virtually going to have a free hospital. The £1 billion strategic investment was going to deliver 45 million a year in interest, and we were going to pay 2% borrowing costs. That's my understanding. When I spoke to the finance people in August, I asked how the fund was going currently. I was told that it was likely this year to lose 15 million and borrowing costs would be up at least 2%. And if anybody can do any basic arithmetic, I think we're looking at something in the order of an £80 million deficit in year one. And from our point of view as people who've been voted in to look after public finances, I think that was bit like looking down the barrel of a gun. So I think from our point of view, that was our starting point. And I know it was based over a 40-year period, but you don't have to have too many years like that at the beginning before the whole thing runs into a catastrophe. And we're looking at signing a contract of £1 billion in the first instance. I think it'd take a braver man than me to do that in the current financial climate, the current global climate.
Okay, let's go to Deputy Gorse about the finances.
We can keep looking back, but we cannot escape from the fact that during the course of this year, and there's all sorts of reasons for it, the previous administration were not able to deliver the hospital for the 804 million. We could tread over all that, but when this government came into office, the Chief Minister rightly wanted to undertake the review, because you could not have built what was previously proposed with the agreements that the states had made. So any new government would have had to go back to the states. You couldn't have delivered it for the cost because of rising inflation, and official advice was absolutely clear. You would not go to the market to do with one contractor on in a rising inflation situation, because otherwise we'd be right now negotiating with a contractor with interest rate liability and an inflation rate liability sitting with the taxpayer. So you would have to be, you've done that work that says it's 115 million more. We know that inflation's increased from that 7.9% to now 10%. We know that in Jersey inflation is forecast to potentially increase a bit more. We know in the UK, where you're going to be bringing in materials and the global material market is going to continue to increase. So let's say that the electorate had decided that we weren't the people that were going to come back, and you had exactly the same administration that you previously had. That administration could not have delivered what has got planning permission within the agreed decisions, nor should they sensibly have signed a contract, because they wouldn't be able to control that contract and it would be a liability to taxpayers. So in some respects, I think we should stop arguing about the past and start thinking about how are we now going to deliver suitable health facilities, yes, that are affordable within the current economic climate, and work together to deliver it. And I for one, think that Tom, with the support of the Health Minister, is doing a good job on starting that process.
Thank you. I think you were part of the previous administration that you said wasn't able to deliver. So, Chief Minister, we need some confidence that this government is going to be able to deliver a hospital and start digging at some point. Can you give us that confidence?
We can, yes. And I think I said at the beginning that there is a clear direction of travel, and this helps us to unlock the situation that we find ourselves in and actually move towards a delivery of healthcare facilities. And these are healthcare facilities for our whole community, and because we have a duty to balance the needs of, yes, the healthcare staff who will work within it, and we want to support them and actually improve the culture that they're working in and the living conditions that they have in the island when they come here, because we greatly value them and their contribution to the island. But also we have to balance that out against the rest of the community. And in actual fact, we feel that the two-site option gives us greater resilience. We've all learned throughout COVID how it is difficult keeping a single site hospital open in those pandemic conditions. And there may be other challenges ahead for our medical services, and so we feel quite strongly that a different solution can actually deliver a resilient as well as an affordable, pragmatic Jersey-sized solution for us all.
Okay, thank you. Can I come back to the audience? Any more questions from the audience? I know some of you, you're thinking lots. If not, we can go to Slido and come back to the audience. Okay, so questions from people at home. Haven't you just devised this report that came to the conclusion you wanted all along? How can you reassure islanders you gave proper consideration to all the options?
I'm at risk of sounding like a broken record. I'll just refer you to the comment I made earlier. I explained that situation, that I came to it with an objective, open mind.
Okay. Will you be reviewing the management structure of the new hospital? One nurse said to me, we have 120 managers now and I'm coming across new ones daily and with no experience. They are children. I could go on, but as I know, I can't.
Well, it's perfectly clear to me that we've got to review the way in which we operate and deliver care across a two-site option. So we wouldn't just take the current arrangements that we've got and continue, because some of the ways in which we want to change the way we deliver care will require different leadership arrangements. It will require different types of skills and competence to build the kind of offer to patients. So yes, we will be looking at it. I think workforce is a really important enabler to what we want to do, because you can have a building or two or three or four, but the key thing that actually affects the quality and the safety of services is how we will deliver a really skilled and talented workforce. And that includes both clinicians and managers, and it's really important that we have those working together.
So how are you going to deliver a skilled and talented workforce?
So we're going to be looking clearly at what our gaps are, because we already have a skilled and talented workforce. I think that's important to reflect.
Do you have enough of a skilled workforce? Is there enough people?
There will never be enough. No health system in the world has enough. But what we must do is we must actually build our capability and our capacity. And one of the things that we want to do is to make Jersey a very attractive place to work, for people to come and deliver and provide their best skills for patient benefit here. And the way in which we do that is we offer facilities, opportunities, career development, and also a really good environment to work in. And we believe, in terms of the plans that we've got going forward, that we're in a really good position to be able to offer that to people.
Thank you. We've got a question from George. Thank you, George. The report states a multi-site solution will require increased staffing requirements and equipment. So will the Chief Minister please say how much the duplication cost will be over 40 years?
Well, I think the Health Minister is probably better placed to describe that and to give further detail. But as a whole, yes, the report does state that. But we feel, and having discussed with the expert advisor his thoughts and his input, it's very clear that the duplication would be kept to a pragmatic minimal, and the costs actually would be very low. They would certainly, even over a 40-year period, be very well balanced and a preferable option to the considerable amount of money that this solution will save us in that long run.
Looking at the questions that are coming in on Slido, staffing is a big issue for people. It's a big concern. How are we going to staff the two sites when we can't staff one currently, somebody's asked, and given the existing pressures on recruitment and retention of medical staff, with many staff already leaving the service due to the conditions, pay and cost of living, will the Health Minister please explain how stretching staff over 3 different sites will improve the present staffing? I think you've touched on that already.
Yeah.
We'll move on. But
if I could just add something else to it, Jennifer, if that's okay. I think there is an important thing for the public to consider here is that healthcare changes over time, so our workforce requirements will change over time. So to do some of that predictive modelling over 40 years is actually not deliverable. Because if you remember 40 years ago, we don't care in the way that we do today. So things will change. But I think the important thing is we've also got an opportunity to introduce some very interesting innovation in terms of what the technology can deliver for us. And this is a very common way in which sites, particularly in other jurisdictions, improve their systems and their processes, and also their workforce productivity. What we want to get out of our clinicians and our workforce is better working conditions that improve their productivity, and there are ways that we can do that. Rather than stretching people, we can bring some enablers, particularly, for example, through technology, better working conditions, new ways of working. This is really part of our modernisation of the system.
Okay, thank you.
Just make a comment.
Sure.
We're only 18 weeks into office, and whether you built Our Hospital project or what we're proposing, you're a minimum of 4.5 years away. So I would say there is a reasonable amount of time to build up the staff and do the training and the recruitment. So it's not as if you're moving in tomorrow. So we just do have to bear that in mind.
I think that's fair. I think what I have heard said is that you're 18 weeks into office, you're overturning a decision of people who were years in office before you. And I think
if I might say, it's the electorate that's overturned things, and they've put different people in, and I think they did that I think they made their feelings known. I think that's fairly apparent.
Deputy Gorst, what's the projected total cost for the new project?
Well, this is where it gets not straightforward. So you've just, somebody's just asked a question about the costs of the revenue costs, as we call them, so the daily running costs of a two-site, dual-site approach to it, and the fact that there might be some duplication, but that's as the Chief Minister has said. We remind ourselves, of course, that the previous project, there was no analysis or figure of what the actual running cost of the hospital was. It was just hoped that the current cost would also translate into the new cost, but there was no work done on that. So when we come to the total cost, the review says it should be delivered within, I think it's the 635. I look to Tom there, but that is a lot more work is needed, as the report says, and we will need to think about not just this dual site approach, but a phasing so that what we do can be affordable and can respond to the prevailing economic conditions at the time. But the independent reviewer was absolutely clear that there can be a saving by taking this dual site approach with a phased approach, and that can be a substantial amount of money. I mean, even conservatively, I think he said to some ministers it could be 170 million, even if you row back from that, because the infrastructure minister is a very cautious man. He rows back and says, well, let's be even more conservative. Put that against where we currently are if we went ahead with the Overdale site, which we keep having to remind ourselves of. You haven't now got the permissions to do that hospital. The cost, because of inflation, has grown to over 900 million, and probably today, with today's inflation, is 970 million. So you really were talking about £1 billion hospital. And I don't blame anybody for that. It's just the market conditions and the economic conditions that now prevail. So there can be substantial savings from taking this revised approach.
Okay, thank you. Now my iPad is superheating in my lap here because of the number of questions that are coming in. So if I can encourage you to keep your answers crisp from now on, that would be helpful so people can get their questions asked. Before building a new hospital, can the government, this is one for you, Chief Minister, please, can the government please detail where the £100 million has been spent and what will happen to that £100 million worth of spend as a result of the new project?
Okay, well, we talked earlier on in the evening about the number of different projects that have been considered over the past 10 years, and that £100 million has been spent on those various iterations on planning, on consultants looking at clinical adjacencies and various other things that have got us to this point in supporting those various projects. And so not all of that money is lost. In fact, we have a wealth of, and I meant to bring all of my files with me actually, because I've got files that's sort of about that high. So not all of that is lost, and we have a wealth of information available to us to assist us in the decision making that goes forward.
Okay, there've been you've missed an amazing opportunity to borrow money at low rates, and you would now be getting a higher interest rate on that borrowing. How are you going to get over this massive mistake and justify the extra costs? Question from James. Minister?
When did we miss that opportunity? We came into office on the 22nd of June.
But the interest rates have been, the costs have been going up substantially in the 18 weeks that you've been in government.
Ian might be in a better position, but you can't go out borrowing money when you don't know what you're borrowing it for. So these are far too early days to be borrowing money for that project, in my view. But I think Ian might be better positioned.
So this is where it can seem that government is a little bit bureaucratic, but you wouldn't, even in the private sector, unless you were in effect gambling on the bond markets, which nobody would do with taxpayers' money, you couldn't go to, and you shouldn't go to the market without having a contract against which you were going to borrow that money. And for all the reasons that I've just explained, that the previous government were not in a position to agree a contract. Maybe we'll come on to that partner and how that relationship evolved. They were not in a position to agree a contract, and therefore the Treasury were not in a position to go to the market to borrow the money. And have we missed the historical low rates? Yes, of course we have. We did manage to get historical low rates to pay off some of the previous pension liabilities. But had we done it, we would have been gambling with taxpayers' money, and under the public finances law, we are not able to do that.
Okay.
That's why we need to, as quickly as we can, make progress.
Thank you. Let's move on. We've got a question from the gentleman at the back in the audience, please. Yep.
I'm Dr. David Ning. I'm a consultant of the hospital, and I've been very much involved in the gathering information, the development of the Our Hospital project over the past 4 years. I think there are consequences of delaying the build and splitting the sites. An example is Overdale. Reopening Overdale was a political decision because it was best for a handful of patients. But there have been consequences of that decision because the occupational therapists and physiotherapists that have moved up there have left the main hospital. As a consequence of that, patients being discharged are being delayed because they don't have the physiotherapists and occupational therapists to assess them and discharge them home. As a consequence of that, there are bed blocking, and as a consequence of that, surgical procedures have been cancelled because of that. And that's the consequence of splitting the two sites. Healthcare assistants have been ordered to help on the wards because they are short-staffed on the wards. And they couldn't do that if it was a split site. If you had a so-called hot site and a cold site, a healthcare assistant couldn't bail out the wards on a different site
Do you have
easily.
a question, Doctor?
Yes. My first question is, I suppose I was going to say some more, is can funding of the single site be phased? The second is, can you stop using hospital and staff as a political football and continue with the democratically agreed plan without further delay and wasting more money?
Okay, thank you very much. The first part, Deputy Gorst.
Well, I come back to the point that on the one hand, of course, the previous Assembly made a decision, but that decision no longer has any vires because the hospital cannot be delivered within that budget, and B, using that funding method that was agreed. And so it's not that you have a new government coming in and overturning a democratic decision. It's the economic circumstances which have rendered that decision undeliverable, and therefore any incoming government needs to do that review to see what is possible in order then to get a new decision. And it's a good question about could you phase it. The reality is that what was agreed by the states was that you'd have one main contractor arising out of the delivery partner, so that you had to deliver it in that particular way. And we come back to, did we have our preconceived ideas before this review started? And Tom said he didn't. I did have a preconceived idea. I thought you probably could chop a floor off, scrap the road, and you could do something about reducing costs. But the independent person that's worked with Tom has come back and said, actually, no, Deputy Gorst, that's wrong as well. What you need to do, if you're really going to save some money and you're going to deliver a fit-for-purpose health service, is think about it in a different way, and that's the right thing for us to do.
So people need to be confident in a review that's taken 2 months versus the reviews that took years that have been openly debated in the States. That's what you're asking everybody to do.
Well, I am saying that it is quite clear to me that the previous decisions of the states, because of economic...
Of which you were part.
Of which I was part of, and I'm not saying, I'm simply saying that when we made those decisions were made in very different economic circumstances, and the expectation of what would happen hasn't been delivered, and therefore the government has to go back and undertake this review if they're going to be responsible and actually able to deliver improved health services.
Okay, thank you. Let's move on. Let's talk about the staff being, sorry, excuse me, let's talk about the staff being a political football in terms of healthcare staff feeling tired of all of this process. How would you address that?
Well, I understand that, and I think everybody, is waiting for us to come to the point where we actually have a healthcare system that will be sustainable, that will be recognisable, that people will recognise as that's what healthcare looks like in Jersey. But for me, in terms of being used as political football, I don't accept the allegation. I think we have a very important commitment to make to staff, which is to say, if you want to be part of what we're trying to achieve here, we must have your engagement and we must have your commitment to helping us find the right solution. And the challenge for clinicians, and I am one myself, is that we have to take account of the economic conditions that we are working in. And that is something that is a reality. It is not about using staff as a political football. It is about recognising that as clinicians, we all have a duty to spend taxpayers' money efficiently and effectively. And one of the things that we're trying to secure here is a really good value for islanders.
Okay, let's go back to Slido. I realise that there's lots of opinions. Whilst it's good to hear that many millions of pounds can be saved, how does the budgeted year-on-year operating costs compare with the single site option? And will this figure be part of the States Chamber presentation to allow considered decision making? So first of all, I'll come to you, Deputy Gorst, but Chief Minister, are you taking it back to the States Assembly to be debated?
We will, yes. We've already been to scrutiny and talked them through what we think will be the process. Deputy Binet and I went to see them some weeks ago. So what we will have to do initially is amend the government plan. So we'll be asking the Assembly to do that, because at the moment the budget for next year includes the spending that was projected for the Overdale project. And then we will be bringing before Christmas a proposition to the Assembly to ask them to endorse this new direction. And having given scrutiny time to go through the proper democratic process, we would expect to be debating that around February.
Okay, thank you. Deputy Gorst, do the figures that you're talking about, do they include inflation? Do they include contingency plans?
So we're at a very high level now. And one thing that strikes me from the questions that we've had so far is it can easily seem as though, this review is slowing everything down and we're going back to the drawing board and it's too high a level in which to make a decision. But we do actually now have that time, because it's quite clear advice, as I've said it and I'll say it again, because I think it bears repeating. You would not and you could not, and it would not be sensible to go to the market now to sign a contract with a developer to build what was previously proposed on the Overdale site for all the reasons that we've said. So that does actually give some time to do more work. Tom will come with his, we call them business cases, and you have early stage ones and ones that take a bit longer. It gives Tom now time to do all that work, to come forward with much more detailed figures. But the independent person who's got experience of building hospitals elsewhere, ones that are single site hospitals as I understand it, but Tom knows more, ones that are dual site hospitals, got all of that experience, is saying that this is the best approach for us to do if we want to deliver a suitable healthcare facility. So we've now got that time to do that, and that's exactly what the Infrastructure Minister will be doing.
Okay, thank you. So we're going to take 30 seconds now, just going to show you a very short video, and we're going to come back and talk about the suitability of the site. Welcome back, everyone. Don't forget, you can put your questions on slido.com, use the code OHReview. We've got lots and lots of questions coming in. I'm going to go back to our live studio audience to ask some questions. Gentlemen at the back, please. Yeah.
Hi, Ben Hughes, doctor at the hospital. The Health Minister mentions clinical engagement. Can I ask how many of those 60 key stakeholders that were involved in the review were hospital consultants or healthcare professionals that work in Jersey? As far as I'm aware, the NHS is in disarray, and especially the NHS in Northern Ireland.
I don't have the numbers that we had. I can't remember the actual number, Ben, but I would be happy to provide that information for you. But there were a range of clinicians that were involved in the review that has just been undertaken. And I think it's a really important thing to mention, which is this is not, with all due respect, not just about consultants, but this is about nurses, doctors, therapists, porters, admin staff. You know, this is their environment in which they work in. And I think the clinical engagement piece, I think, is a catch-all for, maybe we should refer to it as staff engagement rather than clinical engagement, because we do need to do more of that in terms of our direction of travel. And it would be my responsibility to make sure that we've got the right level of engagement from all of those staff groups.
Okay, thank you. Gentleman at the front here.
Hello, my name is John Baker, Jersey Action Group. I'd like to cheer the conversation up a bit and talk about saving some money. Some time ago, an application was made to demolish the buildings at Overdale in their entirety, but the planning law doesn't allow for that, and in fact that application was turned down on the basis that the main building, the Samray building, the building that includes Samray Ward, and the William Knott building were really fit for purpose, and there was no good reason to knock them down. In fact, the public demanded that the Samray Ward facility be put back, and that eventually, I hope, is finally going to happen. The William Knott building is supplying currently facilities that haven't even been planned in the new hospital. So we have existing buildings up at Overdale that are fit for purpose. We've also got, I believe, some buildings up at Five Oaks that not only are fit for purpose, we're still spending more money on them. So surely we don't need what we originally had in this new plan for Overdale, which was all the bells and whistles and flutes, you know, the world-class thing that really is not what we want. We just need a newly built acute hospital, and we have other facilities that can save money by retaining them. Can we listen to your comments on that?
Deputy Binnie, you've been itching to get involved in the conversation.
No, sorry, if I've been too enthusiastic. No, I think you make a reasonable point. I think one of the things that's upset a lot of people over here with our hospital plan was the amount of infrastructural damage that was going to be caused. The taking down of the Bowls Club, the building a £20 or so million superhighway, knocking down 14 houses, some of which were new. And of course, got the controversy over the buildings as well. And I think what this is seeking to do is to save some of that money, try and minimise the damage that's caused. And yeah, there might be some operational offsets in terms of cost, but there's a substantial amount to be saved by trying to take a more pragmatic approach to the buildings that we've got. It is worth saying that Le Canave has been designed to decant some of the operations at Samray, and because that was already underway when the contract was signed, and it would have cost more money to stop it than to continue. We've continued with that, and the thinking now is that could be a long-term facility.
So you'll be able to save, I hope, some of the buildings at Overdale and maybe some at Five Oaks.
Well, certainly working our way up. I think, subject to this being approved by the states, the Bowls Club, the road itself, certainly no major infrastructural spending, and the 14 houses. I've got to be completely honest with you, there needs to be a cost-benefit analysis done on the remaining buildings as to how much that may or may not compromise the development of the site. And that's just simply a case of looking at the value of the building, what it does, and how much it would or wouldn't affect any further development that took place. So that's one that sticks in my throat a little bit, but it's something we have to be honest about, and I'd rather mention that at an early stage. And as I say, all subject to the Assembly passing this proposal.
Thank you. Thank you. So more questions from the audience. Gentleman here.
Hello, I'm David Hopkins. I'm a physician, new to Jersey, arrived 3 months ago, so I've got no past history.
So this is the only government you've ever known in Jersey, then? That's excellent.
So coming to this fresh, having managed services across multiple sites, I would naturally have preferred a single site solution. Accepting that that might not be an economic reality because of the limitations of the individual sites not being suitable, I can see why we may have to go to multiple sites. What I consider is that the real challenge here is, what do we mean by multiple site solution? And what will be the balance of services between a hub site and other sites potentially around the island, because that really is the whole thing of how we make this work in practice, and how we make this either efficient and safe. How do we get to that position of having a clear model for how services will be divided between sites, and what do we really mean by multiple sites?
Yeah, thank you, and thank you for your question. What we're describing, I think, in terms of multiple sites is the facilities that we've currently got at the moment. We need to obviously consider how best to optimise those and use those. But one of the things that you've touched on just there is the fact that this really gives us an opportunity to completely remodel the way in which we deliver care. And one of the things that is really critical to that is our engagement with primary care colleagues and also other primary care bodies who can deliver care in the community. For me, I think this creates a really good opportunity to explore new ways, and I did allude to that earlier on, new ways of working, and actually start to focus on delivering those kinds of offers to patients in ways perhaps that they've not considered. And care changes over time. Not everything needs to be delivered in a hospital, but clearly we do need a hospital facility. But your point about how we actually use those facilities across the island is really important, and that will factor into some of our planning going forward.
I mean, certainly some of the correspondence, a question here from Robert, is that the trend seems to be moving away from multi-site hospitals due to the costs and to the point that the gentleman mentioned. OK, thank you. More questions from the floor, please. I think there was somebody over here. Yes.
Hi, I'm Stephanie Constantine. As a layman, what concerns me is the actual hospital itself. Does this mean that there's going to be years of Kangos drilling and hammers hammering, and the patients and doctors having to work, and nurses having to work under these circumstances?
Will the hospital be a building site for a period of time?
Well, the plan would be, because there's an existing planning permit now up at Overdale to develop Overdale, and at some point you can decant a good deal of what's happening in Gloucester Street whilst you're starting the initial works. You'd have to, if you look at the phasing that's been proposed, and it is only an initial proposal, but the groundworks and so on would probably take place in Kensington Place before the first decant. And as that started to come out the ground, you'd have a lot of what's going on at the hospital now would have been relocated. So yes, there'd be a degree of interruption, as there has to be, but if you bear in mind that there were 104 or 105 flats that were going to be under construction in any event, that would have been the same scenario. And you've also got to bear in mind that the majority of the demolition in Kensington Place has already taken place.
OK, thank you. We'll take one more question from the floor, sir, and then we'll go to Slido. Yes, please.
Good evening. My name's Salman Zaman. I'm a clinical radiologist, consultant at the hospital, but I'm here today as Director of Medical Education. What I'm looking for is a commitment from the government that they will place education and training, not just of doctors, but of all healthcare professionals at the heart of what we do. We've already alluded to the shortage of staff, and if we're going to attract staff here, be they doctors, nurses or allied healthcare professionals, we need to provide them an environment of good training and supportive education. It is a privilege that I do my role because Jersey has the enviable reputation of being an excellent training place for junior doctors. We're number one in Wessex Deanery, I think in the top 30 in the whole of the country in terms of foundation trainees, and I want to maintain that momentum. I would disagree with the colleague, the gentleman here, who said we shouldn't be aspiring to world-class facilities. We should. Health is important, and whatever facilities we provide to recruit good people to provide that healthcare has to be of world-class status. We are competing on the world stage, globalization, as you've already alluded to, there's a shortage of healthcare professionals in the English-speaking world worldwide. We have to attract people from outside. Jersey cannot provide those professionals in-house. We can't grow our own. So we have to have world-class facilities to get those people coming here.
And your question, sir, is the staffing going to continue?
Well, no, I want the commitment from them that we're talking about costs and cutting costs and budgets. I don't want education and training to become a casualty to that.
Is that on your radar, Deputy?
It certainly is, and I think that is one of the key areas that is important to address as part of the redesign and the remodelling. And through this proposal for our two-site option, we've really got to examine how we actually protect the capability to provide really good training facilities for people. So that would certainly be my commitment to continue to develop that going forward. The issue is, again, how we manage to get an affordable solution to that, and that would be something that I would want to work with yourselves to consider how best we can do that going forward.
So a question from Slido, just building on that point. Are we going to build in a proper review of HCS staffing pay and conditions to continue to attract and retain staff? And will the government commit to paying for that?
Well, I think this is this falls outside of really the report that we're here to talk about tonight. But attracting people into the island, we've got to make as many attempts as we can to actually make this a really good place to work.
If I could just add to that, and I mentioned earlier culture being one of the critical things that we have to make improvements in our healthcare, and that also means the offer that we have. And it's wonderful to meet a new physician. Thank you for coming to the island, and I hope you're enjoying it so far. We know that we need to be a place that people want to come to work. We have a fantastic offer in terms of a wonderful island to live in, but of course we want to make sure that people enjoy their work here, that they enjoy a good quality of life, and so it is important that we are very mindful of that package, and it's something that we take very seriously.
Okay, thank you. So I wonder how many times you've been asked this question, Deputy, but why not bite the bullet and build on People's Park as a one-site option and in the best place? Forget any covenant, as the stakes can change anything if they wish. That's quite a popular question.
I bet it is, but we took the view, having had 2 tours of the existing hospital and having very comprehensive tours, and looking at the state of it, we decided it would probably take another 18 months or 2 years onto the whole process to reopen it. And the minute you reopen the site selection process, everybody has got a different view of where it should be, and you then have to go to a planning review. And I just think that we deem that to be impractical given all the circumstances.
So the People's Park option is off the table?
As are all the others.
Okay.
When we came to this, we had to be pragmatic, we had to be sensible about it and say, well, what's doable under the circumstances?
Okay, thank you. Back to, is the new proposal still based on care in the community? How will that be offered when we are already short of GPs now?
Mm-hmm. So as I've described previously, this really gives us an opportunity to remodel the way in which we deliver care, and we will be challenging some of the existing ways in which we do deliver care currently. We have got to try to use all of the modern, innovative methods of improving the quality and the safety of care that we provide, and one way to do that is to work with patients to identify what is important for them in terms of a service offer, but also to put the check and balance in to make sure that it's compliant with good clinical practice and it delivers really good clinical outcomes for people. And what that means, and you will see this internationally if you look at the evidence base, is that care is actually starting to shift into different environs. So we are seeing more care in the community. And the question about the workforce is that we have got to address the workforce challenges and to think of new and different ways in which we can actually address some of the challenges that we face. And I think the answers are in the community around that. And, you know, I would welcome people's involvement in helping us shape that future workforce commitment and requirement around it.
Okay, thank you. A question that's growing in popularity by the minute. It's an unusual question, but do any members of the panel have private health insurance? I suspect it's being asked, or do you use the services that the general public use? Can you queue jump, or do you go off island? Do you actually use the hospital as it stands? Anybody want to take that, or is that a private matter?
No, I'm quite happy to say I use the hospital. I've used particularly for my children, we've used it frequently. For elderly family members, they use it as well. And I've got nothing but praise for the staff in the hospital, and that's why when I hear Dr. Ning and the medics talking about just getting on with it, don't play political football with it, I absolutely understand what they're saying, and it's incumbent on us, now that we've got this in the conditions that we find ourselves in, that we really do make progress, and I know that ministerial colleagues are committed to doing that.
Okay, a question for you, Chief Minister. John has asked, what will stop the next set of politicians undoing this work and starting again? The project can't be delivered within a 4-year political cycle, so it has little chance of ever succeeding. Politicians need to step away.
Well, our process is political, and we've been selected by the public to take those decisions on their behalf. But we feel very confident that we can get this project under delivery within this term of office, and that's absolutely what we're determined to do.
Okay, wonderful. Thank you. My screen's just packed up. Why has it taken so long to get to this point? Can I ask? I think you've already alluded to the answer here, but...
Right. Are we looking back 10 years? Why have we taken 10 years to arrive at this point? Well, as I say, I can only be responsible in my area from the 22nd of June onwards.
Let's ask Deputy Gorst then, because he's been in the government for quite a while. So, and you were Chief Minister at one point as well. So why has it taken so long?
I wasn't ducking the question, by the way.
Because I think Tom made a good point. Had we now started to reopen the site process, which is what previous governments have done, rather than just trying to deal with what was currently on the table and think, okay, how can we make that work, which is what this review has really done. Had we done that, then it wouldn't have taken so long. And I think that it shows the commitment of the government that it has come and is trying to bring forward a proposal that is deliverable, when the other one wasn't, for all the reasons that we've said, and we're not reopening and going back to square one, which is what other governments have done. And that's why I'm confident that actually good progress can be made.
Okay, good stuff. One for you, Minister. The Infrastructure Minister keeps saying that many people didn't want the hospital at Overdale. Could I ask him exactly how many people? I took part in a survey by a Jersey consultation firm and was one of the 7,500. The majority thought it was a bit big, but were in favour of Overdale. So where is your proof?
I haven't got any statistical proof, of course not, but I have to say that this has been underway for some time. If I emptied my inbox, my WhatsApps, my texts, my phone calls, I can't walk down an aisle of a supermarket doing my shopping without somebody tugging my sleeve and saying, keep going, this is the right direction. I have had one email against it, and we've had quite a lengthy exchange. One email. So I can only go on the evidence that's been presented to me. And I have to say I stood for election saying that I wish to bring the hospital project under control physically and financially. That's what it said in my manifesto. And I had a reasonable result of the election, which can only indicate to me that there was some support for my thinking.
Yep. Okay, thank you very much. Deputy Wilson, I believe there are over 100 managers running our hospital. Will the Health Minister be reviewing the management structure within the new proposals, as it seems there are far too many chiefs and not enough Indians?
Well, that's an observation, and I think that what I would say in response to that is that whenever any system or any hospital facilities are redesigned, there is always a need to review the way in which those services are led and organised. And again, that would be something that I would actually involve clinicians in helping us to get to the right solution, putting the right leadership, the effective leadership arrangements in place. And we've already got some really good clinical leadership examples that we can draw on to actually build on. And I think the most important thing is that we have good management capability as well as good clinical leadership capability. And I won't support or condone manager bashing, as it were, because managers and clinicians working together are capable of really delivering good outputs and good outcomes.
Okay, a final question on Slido for this section. From Phil, in the past the debate on the hospital site has prevented the development of a modern, fit-for-purpose, sustainable healthcare system. It's just jumping about here. As the ministers have decided to restart the debate, can they explain what actions they will take to prevent this once again from being the case? So overall healthcare system, how does this fit into that?
So in terms of, sorry Jennifer, could you just repeat the
So
question?
in the past the debate on the hospital site has prevented the development of a modern, fit-for-purpose,
system.
sustainable healthcare system.
Okay, so I think what I would like to communicate here is the fact that when you're designing care and you're designing care systems, that we shouldn't think of it in terms of what a building or a facility can offer it in terms of just the solution to the issues that we face in terms of delivering care and support to people. The thing that we have got to be able to do is look at how we want to provide care and how we design that care, and then what kind of health facilities we want in response to that. And as I said before, healthcare changes over time, and we need those facilities to be really flexible and adaptable so that they can respond to that changing health need.
Okay, thank you. We're going to show you another 30-second video, and then we're going to come back and talk a bit more about health. It's the final segment, so please do get your questions in on anything to do with the hospital, and we'll try our best to cover them. Thanks very much. See you shortly. Welcome back. We're in the final segment of our question and answer session to the ministers on the hospital project. Slido.com is where you can ask your questions if you're at home. OH Review is the hashtag that you need to use. I'm going to go back to the live audience that we have here in the studio and ask some questions of them. Chris.
Hi, Chris Edmund. I'm a hospital clinician and I run an occupational health practice. One of the things about keeping staff healthy is managing their workload essentially. And just building a little bit on a point that was made earlier, in terms of staff in the current hospital often need to be in two places at once because they're called to review patients on the ward, they're called to A&E, they're called to theatres. One of the things we need to build into the system is resilience in terms of our staffing as well as our facilities. And there might actually be a positive to be gained out of splitting the site because then you're more dedicated to the individual role you're doing at the time. For example, rehab staff should probably be dedicated to doing just rehab. And I think I was really pleased to hear the Minister say earlier about getting the model sorted, getting the staffing sorted at the early stage, because I think that was missing from the previous iteration of the project. But I wonder how and when will we start to see some of that so that it can then feed into the overall hospital building project?
Thank you, Chris. I think once we have a decision in the Assembly, I mean, this is from the word, you know, that decision is taken, we start. I've said to people all along that we will never achieve what we want to achieve just by building a building. What we're trying to achieve is a healthcare system that delivers really good clinical outcomes for people. So the earlier that we start the design of that, which is the critical part of it, with the clinicians and with patients around that. And I know I keep repeating that, but it is absolutely critical to the way in which we need to move forward. There have been some previous criticisms about, the kind of engagement that's gone before, but we've now got a chance to actually put this right and to be really clear about what we can do together to deliver a really good model of service going forward.
Okay, thank you. More audience questions. I'm favouring people. The lady there with the blonde hair.
Hello, I'm Tamara. One of the things that you've made clear, Deputy Gorse, is the economic circumstances that we find ourselves in now, making the prior project undoable, which I will not repeat. But another aspect which we haven't spoken about tonight, which I think from an infrastructure standpoint, was the 700 construction workers that were to be required on this massive single site, which I don't think were feasible even prior to these economic circumstances, never mind now. So the question's actually for Deputy Benet. Are you confident that, based on the phasing plan, that current construction or local construction firms can handle this without the requirement for many hundreds of new construction workers to come into the island?
Yeah, well, thank you. That's a very good question indeed. A lot of our thinking has been around the business of phasing to make it more available to local construction firms. We've been working with the Construction Council about how that phasing might work. And even trying to tie it in with some of the other major projects going on the island, so we can fully utilise the construction industry throughout the whole of the 8-year period. And that should take a lot of pressure off in terms of bringing staff in and keep a lot more money in circulation within the island. Another thing that we found was a little bit disturbing was the choice of the 8th biggest construction company on the planet to do this, because they generally tend to carry a big overhead with them. And I think we could approach this phased approach in a slightly different way, which does enable much more local engagement and involvement and a lot more money being kept on island.
Good to hear. Deputy Farnham.
Thank you. I'd like to press Deputy Gorst on a matter he mentioned earlier. The expert, Alan Moore, who is a good man, he's an expert more so on what goes on in Northern Ireland than in Jersey. And he said at a presentation to States members unequivocally that the Overdale site was the best clinical option. He said that I had to stand up and ask him to repeat it. But he said he couldn't recommend that because of the affordability. And the affordability is not so much we can't afford it, because actually Jersey can afford it. We're in a very good financial position. We can afford it. But this new government doesn't want to spend. I think the new government needs to be honest, say we don't want to spend potentially that much. We want to come up with another solution that fits our spending ideas. The timeline about financing in the original project was set for planning permission to be obtained in September to October last year, and then we'd go to the market for a bond after that. We couldn't go to a market for a bond until we had planning permission. Because of the delays, and I'm not criticising, Deputy Moore was doing a job as a chief scrutineer, and the Constables and Helier presented amendments to the propositions in the States Assembly that caused up to 6 months of delay. That pushed us into this year and into the election period, so we couldn't complete. Had we not done that, we'd be able to have gone to the market in Q4 of last year, secured a better bond rate, and we'd be building now. So that's what happened. It has become a bit of a political football, unfortunately.
Can we get to your question, please?
But that's the way it works, yeah. I want to, on the affordability, because this is the new review basically is about affordability, and the predicted price of 635 million does not include provision for inflation contingencies, ongoing government of Jersey civil service costs, writing off about 51 million of the existing project, compensation costs related to the Kensington Place building, the loss of significant income from land disposals, the cost of maintaining the current hospital facilities for longer. I'm nearly there.
Please.
And the additional detailed financial and logistical running costs. So if you add that to your 635 million, come on Ian, you're an accountant, you must say there's a very real, it's highly unlikely we're going to be able to deliver this for the money we're talking about, and we should actually do the work, get the detail. I've lodged a proposition today that asks the government to do that, and before abandoning Overdale, come back to the Assembly with the detail to prove what you're saying in your review is correct.
Thank you, Deputy Minister.
So I take the view that in my political career I've got lots of things wrong, and there's a question on there saying if the review had come up with something else, would you have accepted it? Yes, I would, because the thing you learn when you've been in politics is you make a decision and you seek to move forward, but when you're wrong you've got to just admit that you're wrong and then seek another solution. And we're going to get into a little bit of an uncomfortable area now in answering this question, unfortunately, which I'd hoped that we really hadn't. It is not fair to criticise the previous scrutiny process for why the government wasn't able to deliver the hospital and get the bond. Now, working with the officials that were working on that project, it's now apparent that because of concerns that were previously held, the process itself had slowed down so that control could have been got over the partner that was the delivery partner, and that is why ultimately at that late stage, once planning permission had been got, it was not able to move forward and sign a contract and go to the market, which is what I was quite clear about. That's why it's not fair to try and criticise those who were just doing their job in scrutiny. So that's the first thing I'd say. The other thing I'd say is 635 is roughly what previously was proposed to be able to deliver the previous hospital with contingencies and optimism bias. But the independent reviewer, together with the minister, has come on and said that you can actually do this phased approach for that amount, but you cannot right now do what was the previously proposed project for that. It already has used up the contingency, the optimism bias, and grown by another 100 and say between 15 and another 150 million pounds. So I really don't want to keep making this a political football of blame and let's go round this circle again and this is better, that's better. I think that we, because of where we find ourselves, and some of that delay also, we remind ourselves, we had 2 years of COVID. So the previous administration could have made more progress if it wasn't for COVID. But that was the situation and the hand that was dealt. I think we've got a really sensible, pragmatic approach that responds to the concerns of islanders, responds to the economic conditions, and isn't going back to the drawing board, but really seeks at its heart to provide health facilities which are fit for purpose for Jersey and that we can be proud of, together with all the work that the Health Minister is doing, which a lot of questions have been about as well, which is delivering a new health service in these new facilities. So
certainly there's a lot of comments on Slido about going round in circles and that people just really desperately wanting the government to get on with it, which I'm sure is a sentiment that's shared by you. We've got the chap at the back there, yes.
Hi there. My name is Ziad Haddad, one of the consultants at the hospital. Don't you think that two-size hospital will increase traffic and cause more pollution in the time that we are aiming to reduce our carbon footprint? That's first question. Second question is to the Health Minister. Would you guarantee that the Overdale site, which is giving the summary ward, which gives fantastic service for people with paralysis and who not able to walk, they will not be moved into a cramped place like ward like they were before if you build a new hospital?
Let's start with that one. That's a very popular point of view.
Yes, okay.
Minister.
Thank you. One of the things, I actually don't think Samaray is good enough. I think it could be better. And I think one of the things that we must do in the new buildings that we eventually end up with is design rehabilitation services and rehabilitation care to modern standards. And that isn't to say that the service that people are getting at Samaray at the moment isn't good, but I think it could be much better. And so my commitment would be, through the plans that we're developing, is to make sure that we have really good rehabilitation services going forward, and to build up this concept of rehabilitation and recovery as part of our health offer. I think this is a part of our health system that will only continue to grow as we go forward.
Deputy Binney, do you want to take the point about carbon neutral and two sites?
To be honest with you, on that, I don't think there's going to be a significant change in the amount of pollution that's involved, and no, that's a straightforward.
Okay.
I would pass comment on the other one about the Samaray ward and the intention to put in good facilities for rehabilitation, because I don't think they featured in the hospital project, and it's been a fairly quiet meeting. I thought that deserved a round of applause personally, but there we are. It's a great commitment, and
okay, thank you.
Very good news.
A question from the lady at the front here, please.
Thank you. My name's Jeanette. I'm a nurse working in the hospital. The National Institute of Clinical Excellence guidance tells us that moving patients from ward to ward and prolonged lengths of stay increases the risks to the elderly patients of death and deconditioning. That's to say, loss of physical and cognitive functioning. Given at least 25% of all our patients at the General Hospital are the frail elderly with dementia, is there going to be any dedicated space for active rehabilitation of this vulnerable group going forward?
Deputy Wilson.
Thank you. Well, as you know, Jeanette, we're involved in developing our dementia strategy, and clearly we will need to build in the facilities that will meet the needs of people with dementia. But I wanted to touch on the other point that you just raised there in terms of movement and transition. We will make sure that every single decision we take will have the patient's interest at heart. There is no getting away from it that we will have to have some movements because of the way in which the building developments will emerge. But I think my particular focus and my responsibility will be to make sure that those patient safety and those patient concerns are addressed throughout this whole process. It's going to be very important to make sure that that patient need is addressed as part of any redesign or any redevelopment of our service.
Okay, thank you. We're going to go to Slido, but if your question's brief, sir, we'll hear from you.
Yeah. Part of the Overdale plan was the integration of the Jersey Care model. So my question is, why did the Health Minister decide to put the Jersey Care model on hold? What was wrong with it, and in what ways does she think it needs changing?
Okay, thank you. The reason I paused it have been previously stated, so I don't want to rehearse the same. But I just wanted to give an assurance that having paused it and undertaken a review of it, there are certainly some areas that I have identified that we're not actually going to support the intended outcome. What we've also got to think about is that in the current climate of spending money effectively and efficiently, it was clear to me that some of the expenditure on the Jersey Care model was not particularly well targeted, and that was one of the reasons why it was paused. But it has to be considered alongside this review finding. It cannot be considered in isolation, and so any proposal going forward for how we develop community care will be communicated and considered in the same way as we've talked this evening about how we intend to deliver future hospital-based services.
Thank you. We're beginning to run out of time. We've got an awful lot of questions. I'm going to ask the panel again. We need you answers to be brief at this stage so we can cover as much ground as possible. Deputy Gorst, I'm looking at you in particular there. On page 113, question from Harry of the Hospital Review Report, Alan Moore concludes that all of the assumptions used were subjective and need to be validated by further detailed analysis. When will you carry out proper analysis to ensure that your decision is backed by data?
As soon as we get this through assuming we get it through the Assembly, then as soon as we get it through the Assembly.
Okay, I'm just going to run down the questions in order here in terms of popularity. If you want your question to be asked on Slido, please tick the thumb. Isn't everybody just absolutely fed up with this? I think, yes, we've covered that point. Back to staffing, given the existing pressures on recruitment and retention of medical staff, with many staff already leaving the service due to conditions, pay and cost of living. Will the Health Minister please explain how stretching staff over 3 different sites will improve the present staffing difficulties? We've touched on this already, so a brief answer.
Already. I think we're going to look at our staffing model depending on whatever option we come up with.
Okay. Questions about multi-site, which I think we've addressed. How much more taxpayers' money are you determined to waste going round in circles like this? I think we've covered that point as well. There has been recent correspondence from people on multi-site hospitals. We've done that. Do the costs for the new project of 635 million include provisions for contingency, inflation and optimism bias? We've covered that. Can the Health Minister detail how the impact on the clinical staff working at the hospital will be managed during this extended build period, especially in light of the recent report of current unsatisfactory and potentially unsafe working conditions?
I mean, my commitment is to support staff and patients through this process, and I think any impact on staffing, any impact on the patient experience is something that we will consider as part of our planning.
Okay, thank you. I'm going to come back to the audience just in a second. I'm being asked in my ear if we want to extend by 2 or 3 minutes just to get through some of the questions, but we'll do our best to stick to time. Surely it doesn't require 120 managers to oversee a 200-bed health service. That's something to consider when you're doing your reviews. Working in construction, I know that delay is costing a lot of money. Will the Chief Minister state what will be the extra cost to a £600 million project as a result of the 2-year delay, as I know building inflation is estimated at 18% this year alone?
Well, one of the reasons for taking this pause and finding a new way forward to deliver a Jersey-sized solution for our healthcare facilities is simply because of that situation that we find ourselves. We entered government in July and we're very well aware of the economic conditions and we want to find a pragmatic solution for Jersey.
Please confirm that the necessary clinical staff who work at the sharp end have been consulted and approve of a multi-site hospital as a working solution. You're going to publish the data of who you've spoken to?
Yes, I will.
Yeah, okay, so we can come back to that. Where has the data gone? I know looking for the link to our hospital.ge, we can't see a comparative between the new scheme and the old scheme on the panel. Can the panel confirm that this will now be shared?
Happily, yes. Our hospital website has been closed down, the information transferred to the government website.
Okay, thank you. There's a lady at the front here. You wanted to...
It's a two-part question, actually. One is that Deputy Farnham says that Deputy Binet's review is light on detail. However, Deputy Farnham's previous iteration, I'm afraid, was very light on detail, and that was a full planning application. You couldn't find out how many beds there were supposed to be. Every time you asked the question, the number differed. Departments were being shrunk. Some departments disappeared altogether. Overdale is definitely not the right site. I'm not saying it shouldn't be a one-site option. I'm not getting involved in that argument.
Can I press you
but
for
it
a
definitely
question,
was not
please,
the right site. Can I have a commitment from this government, please, that they will speak to all the clinicians and department heads for their needs, for the actual needs that they need in their departments going forward, and allowing for growth and everything else, that those will be absolutely considered and not shoved under the carpet like they were in the last.
Chief Minister, can you make that commitment?
Sorry, also, can I have one other question? The Jersey care model, we did have a commitment previously, which has never ever been upheld by the previous government, that they would bring the Jersey care model back to the public. That has never happened. It's the Jersey care model in itself doesn't really exist. It's somebody's pipe dream, and in all honesty, care in the community is very, very dependent on a lot of staff that we do not have in, either in the hospital or outside the hospital. Can we have a commitment that that will be taken back to the public, please?
Okay, so let's pick up on that final part. Is it going to be taken back to the public?
Well, Jean and I have spoken about this before, so my commitment is we're undertaking the review of the Jersey care model, and I have a responsibility to go to the Assembly with the findings of that review, and that will be the public space that we will have that debate.
Chief Minister, can we make the commitment?
The previous about going back to the public.
Yes.
Well, the health minister has, I think, identified exactly why she's going looking again at the care model, and then that is part of our engagement process. And I think engagement is something that the public clearly asked for in the last elections, and that's something that we take very seriously. It's why we're here tonight, and we don't see this as a one-off. This is part of our engagement process.
And can you engage specifically the clinical staff and the experts? At the hospital?
I think the previous iteration of the plans focused quite heavily on clinical engagement and...
disagreement there.
Okay. Well, we will use what's been gathered previously, but we will also be doing our own engagement and doing that in a cohesive and coherent way, I hope.
Okay, thank you. Last 5 minutes. Gentleman at the back, briefly, please, sir.
Miklos Kasai, I'm also a hospital consultant. How can we future-proof these plans? Are we not cornering ourselves in by building just what's enough now, and by the time it finishes, it will be already insufficient?
Okay, future-proofing. How do we future-proof these plans?
I think one of the key things to bear in mind, I'll go back a little bit. It strikes me when I looked at the plans that have been put forward in the past that for 10 years we've tried to put twice as much volume on any given site than that site can take. What we're actually effectively doing now is making these two units appropriate to the size of the site that they sit on, and in both instances they will be designed with a view to extending if it's required. There will be space around on both of those buildings to develop and to evolve as the health service evolves. So it's a point well made, and we've taken that into consideration. So yeah, both sites will be appropriately designed for expansion.
Okay, thank you. Ministers repeatedly refer to a two-site option. However, we know the plans will extend beyond Overdale and the General Hospital to accommodate mental health and other outpatient services. Please confirm how many sites will have to be constructed and/or upgraded and staffed.
Well, I think it's fairly plain. In the report we say that mental health services are going to be subject to an immediate and short-term review, and there's been no decision made yet as to where that's going to be located. It may be co-located, it may not, and that's something that will come out of the next piece of work on mental health. The other thing is with the hub at Le Keneve, the thinking is to try and it's going to have to be used for 5 years in any event, and if it works for 5 years, it could work for 25 years and save probably another £25 million of capital investment having to rebuild that after a 5-year period. So that's the thinking on the sites.
Okay, thank you. Given the well-documented suicides and mental distress being faced by the younger people in our community, can the Chief Minister confirm that the cost of £635 million includes a new mental health facility to replace St Saviour and bring us closer to helping our kids?
Well, the Infrastructure Minister just touched on the need for further consideration of the mental health facility, and we all think that that is very important. But of course, mental health care, particularly for our young, is not just about a hospital facility. It's about our community. It's about some of the pressures that members of the public experience in their day-to-day life. It's about their education and support that they find in their education premises and out in the community. And so this is really about our whole and holistic view of the community and making Jersey a place where everyone can thrive, which is really at the core of our common strategic policy.
Thank you. Last 3 minutes of the programme now. How much is it going to cost in penalties to stop the current Kensington Place works when a number of construction companies have signed and sealed to do work on that site for housing?
To the best of my knowledge, there's only one contract involved, and at the moment it's still being defined, the exact sum. It won't be a compensation figure, it'll be a cost recovery figure for stopping the contract. And once that's been done and fully decided, that'll be made public. We don't know that sum at the moment.
Okay, thank you. We've got time for one more quick question from the floor, gentlemen. There.
Yes.
Need you to be brief, sir.
Peter Funk. In the course of spending the £100 million that you spoke about, Chief Minister, we've had no less than 6 consultants who have advised that we need a hospital in Jersey that has roughly 250 beds and incorporates something like 70,000 square meters of space. Now, every time that definition has come up, the politicians have changed it. They can't fit it on the site, so they reduce the number of beds, or they reduce the number of floors or the size. Can this administration confirm that they will give us a firm undertaking of what is to be built, what's going to be in it, and that it will meet the needs that have been so closely defined and are yet to be defined. Thank
Chief
you.
Minister?
I was hoping that he would pass to the Infrastructure Minister, but
You're the boss.
Happy.
Are you going to get that
Happy to
commitment?
take the question.
Yes, well, I think it's absolutely vital that we're clear about what we're delivering. But we've talked this evening about being future-proofed as well. There has to be an element of flexibility. But I'm certain that the Infrastructure Minister, in the work that goes forward, will know exactly what's what in terms of the project, because I know he's a man of detail and he's a man who will deliver a hard bargain for the island as well. So I have absolutely every confidence in his ability to do that and to deliver the best healthcare solutions for us.
I think that's an excellent note to finish on. Ladies and gentlemen, unfortunately we have run out of time. I think we could go on quite a bit longer. I'd like to thank our members of our studio audience for being such active and willing and quite well-behaved participants, actually, given what could have happened. Thank you very much to everybody online. Thank you for your questions. Thank you for voting. It's been my great pleasure to host you this evening on behalf of the Minister this evening. Thank you very much. Good night.